Hi, everyone. So it's just about 3 o'clock here. I know we still have some people joining. So we're going to just get started with some introductions and basics about what we're going to be covering today in the diabetes workshop. So I think we'll do some introductions and get started and get rolling with part 1 here. So welcome to the diabetes workshop part 1. We're going to be focusing on basics and management of diabetes today. This presentation is sponsored by the Good Health Gateway Diabetes Care Rewards Program and is being presented by Good Measure Meals. As you know, today's webinar is part of a 2-part series that we are offering as part of Diabetes Awareness Month. And part 2 of this series will be held on November 29th at 12 p.m. Eastern Standard Time. If you haven't already registered for part 2, have no fear, reminder invites will be going out in the next week or so with registration information. So you'll have more than one opportunity to register for part 2 in the coming week as well. I do want to point out before we start diving into some of the content that if you do have questions during today's presentation, feel free to enter them in the questions section of the GoToWebinar platform. And if time allows, at the conclusion of the webinar, we'll address some of the questions that have been entered throughout the presentation. If for some reason we do happen to be running short on time at the end of the hour, we are going to be keeping track of the questions that come in from our participants, and we will be responding to all of the questions directly on an individual basis following the conclusion of the presentation. All right. So before we get started and we start going into the workshop for today, I wanted to just introduce you to our speakers. My name is Sarah Costa, and I'm an Account and Customer Engagement Manager with the Good Health Gateway program. I'm also joined today by Alyssa Palladino. Alyssa is a registered dietitian with Good Measure Meals, and she'll be taking us through the workshop today, and as well as the workshop on the 29th of November. Before I hand the presentation over to Alyssa and we jump into the basics and management of diabetes, I wanted to provide a brief overview of the Good Health Gateway program. The program is designed to help people manage their diabetes and earn rewards for meeting basic program requirements. Depending on your program, rewards for participating may be in the form of copay waivers or reductions on diabetes medications and supplies, cash, or gift cards. The Good Health Gateway program was developed by Abacus Health Solutions, a third-party vendor that specializes in developing and administering incentive-based wellness programs. Abacus is completely responsible for program design, promotion, and protecting your privacy. No personal health information will ever be shared with your employer. Participants in the Good Health Gateway program are asked to complete important American Diabetes Association recommended standards of care, such as an eye exam, foot exam, blood work, urine test, and A1C test. Some of you, depending on your program, may also have to complete an annual conversation with our diabetes educator to develop a diabetes health action plan that you can share with your doctor. If you would like to learn more about the Good Health Gateway program following this presentation, please visit our website at www.goodhealthgateway.com or call our helpline at 800-643-8028. And as a reminder, you are welcome to submit your questions through the through the GoToWebinar platform, and we'll get back to you following the presentation if we run out of time. And if we have time at the end, we'll also be addressing some of the questions that come in as well. All right, so at this point, I am going to hand the presentation over to Alyssa from Good Measure Meals, and she'll be taking us through the remainder of the workshop for today on the basics and management of diabetes. Alyssa, over to you.
All right. Hi, everyone. Thanks, Sarah, for the introductions. My name's Alyssa. I'm a registered dietitian with Good Measure Meals, and I'm going to be presenting the first part of the nutrition workshop series today, and just an overview of what we'll be covering today and then in part 2 on the 29th. Today we're covering basics in management. So we're going to go through what diabetes is and where does it come from. Are there other chronic illnesses that are related to diabetes? And how does food and exercise impact diabetes? And what is the best way for me to eat to control diabetes, which we'll get into a little bit today, and then we'll expand on that in part 2. And in part 2, we'll really talk about living well with diabetes. So some recommendations for lifelong management, and then we'll also address some hot topics in diabetes care. So thank you all for tuning in today. So objectives for today's presentation. First, we're going to define diabetes. We're going to understand the relationship between diabetes and other chronic health conditions, explore the role of exercise in the management of diabetes, and then learn how food impacts our blood glucose and how to use carbohydrate exchanges to manage our blood glucose levels. So we're going to talk about carbohydrates today. We're actually going to get into carbohydrate exchanges a bit more in part 2. All right, so what is diabetes? An official definition, it's a condition in which the body's ability to produce or respond to the hormone insulin is impaired, and that results in abnormal metabolism of carbohydrates and in turn elevated levels of glucose or blood sugar in the blood and urine. So in order to kind of get a better handle on what that means and break it down a little bit, first let's go through what normal or healthy glucose metabolism looks like. So what happens is we eat food that contain carbohydrates. So that includes bread, pasta, fruit, vegetables, beans, lentils. And as a result, our blood sugar or our blood glucose rises. Our pancreas then makes a hormone called insulin, and that insulin goes into the bloodstream and allows the sugar or the glucose to clear out of our blood and enter our liver cells, our fat cells, and our muscle cells. As a result, our blood sugar or our blood glucose levels go down. And so that's a normal process that happens every time we eat carbohydrates. What happens in diabetes is that process breaks down. So it really happens on the level of insulin production. And so the pancreas either stops being able to make insulin, and that's what happens in type 1 diabetes, or isn't able to make enough insulin, which is what happens in type 2 diabetes. Also in type 2 diabetes, over time, our cells, which are responsible for clearing the sugar out of our blood, stop being able to respond to insulin. So even though our pancreas may be making it and maybe making it in higher and higher amounts, our cells are no longer sensitive to it. And so as a result, our blood glucose levels remain high. And it's those elevated blood glucose levels that are ultimately responsible for some of the long-term consequences that you hear being associated with uncontrolled diabetes. So things like your nerve damage, eye vision impairment, kidney damage. So pretty serious consequences. However, when managed, and it is 100% manageable, which is what we're going to get into in this workshop, you can prevent those long-term complications and keep those blood glucose levels in the healthy range. So here's a visual to kind of show what a normal blood glucose level looks like, and the white dots there are actually representing the glucose. And on the right side there, you could see what your bloodstream would look like with your high blood glucose levels. And so what's really happening is your blood is very thick. It's kind of clogged up with that glucose. So it's not able to get to the cells of your body to deliver oxygen and nutrients and just all the things that your blood is normally doing. And that's what ultimately happens with the nerve damage. So there's 4 different types of diabetes, main categories. We're going to go through each of them. Type 1, type 2, prediabetes, and gestational diabetes. So type 1 diabetes, it used to be called juvenile diabetes because the onset is typically in childhood or adolescence. Only about 5% of people with a diabetes diagnosis have type 1, and it's when the pancreas stops being able to make insulin. The cause is unknown. There's a bunch of different ideas about how that happens. Most likely it's an autoimmune condition. So those beta cells in your pancreas that are making insulin get destroyed. And so in order to manage type 1 diabetes and keep your blood glucose levels healthy, it does require insulin be given because it's not being produced. So it either involves giving yourself injections of insulin, or there can be a continuous insulin pump. There's lots of great advancements now in that, but it does require regular blood glucose checks unless you're having a continuous monitor implanted, because you have to know how to dose your insulin. And in type 2 diabetes, this is far more common. So 90 to 95% of diabetes cases is going to be your type 2. It's inadequate insulin production. So your pancreas isn't making enough. Eventually, it may give out and stop being able to make insulin, in which case somebody with type 2 diabetes also may become dependent on insulin. And the management consists of, it's really nutrition and physical activity. Those are your lifestyle factors that have a big, big impact. So we recommend eating consistent carbs throughout the day, and we're going to get into that at the end of this presentation and the next one as well. Regular exercise, maybe medication. So some frontline medications are often like metformin, but depends on your individual case and what your doctor prescribes, and it may progress to needing insulin. And the cause, it's multifactorial. There's no one cause. It's not caused by sugar. There's definitely a genetic predisposition. So people with a family history may be at higher risk. And then different lifestyle factors put you at higher risk too. So being overweight or obese, being physically inactive, and certain dietary choices too. All right. And prediabetes is basically the stage before diabetes. It often does progress to full diabetes if steps aren't taken to address it. And we say it's impaired glucose tolerance. So when we eat carbs, our blood glucose will rise, and it won't lower quite as well as it would in somebody who doesn't have prediabetes, but it's not quite to the point where you're going to get a diabetes diagnosis. People with prediabetes are at increased risk of cardiovascular disease, high blood pressure, high cholesterol. We'll get into that a bit later. And you do want to make sure that you're checking in once you have this diagnosis, that you're checking in every 2 years at least with your doctor to check for signs of progression. So we'll get into how it's diagnosed, but again, if you're not making lifestyle changes, it may progress. So it's definitely important to stay on top of. And the causes are similar to type 2 since it is sort of a stage on the way there. So a combination of genetics and different lifestyle factors. Gestational diabetes is a condition that occurs only in pregnancy. 9.2% of pregnant women are diagnosed with gestational diabetes, so it's not uncommon. Again, it only occurs in pregnancy, similar to type 2 and how it manifests, but it does resolve after birth. That said, women that develop type 2 gestational diabetes are then at increased risk of developing type 2 diabetes later in life. And there are some impacts, too, on the baby as far as risk for different health conditions, diabetes, obesity, overweight. The cause is not completely known, but it is believed to have something to do with the way the placenta's hormones block the hormone insulin from acting, which kind of makes sense if you kind of think back to how insulin works to help lower blood glucose. So how is diabetes diagnosed? This is important to understand because it's also how you're going to check how well you're managing it. So the gold standard for diagnosis more recently is your A1C. A1C is a measure of how well your blood sugar is being controlled over the past 3 months. And it's based on the amount of sugar that's attached to red blood cells. Red blood cells turn over every 3 months. So if you're looking at the sugar on a red blood cell, you get a sense of what your blood sugar has been like for the past 3 months. So it's a much better indicator of long-term blood sugar control, diabetes management than just a finger prick, a point in time. So a normal A1C is going to be about 5. It can be in the 4s, it can be in the low 5s. Once it's between 5.7 to 6.4, that's when we would diagnose prediabetes. And once it reaches 6.5 or higher, that's when you're going to get the diabetes diagnosis. Other ways to diagnose it, if you're fasting plasma glucose, your fasting blood sugar is higher than 126, that would be considered a diagnosis of diabetes. Although most likely, if you just get that reading one time, your physician is going to order either an A1C to confirm or the glucose tolerance test to confirm. They're probably not going to put that diagnosis on it with just one single reading because there's other factors that could come into play there. 100 to 125, the fasting glucose would be prediabetes, and normal, healthy individuals, you would want your fasting glucose to be less than 99. And then the oral glucose tolerance test, that's another way that it can be diagnosed. If you're given glucose, so simple sugar, and then your blood sugar is tested a certain period of time afterwards to see how well it's being cleared from the blood. 139 or less would be healthy, normal. 140 to 199 would be considered prediabetes, and greater than 200 would be diabetes. So it's indicating that you're consuming glucose and your blood sugar is staying high. It's not being cleared by that insulin. So some common symptoms of diabetes. Interestingly, some of these, so these are symptoms of high blood sugar, but some of them also could be symptoms of low blood sugar, which we'll get into a little bit later. So frequent urination, feeling very thirsty, feeling very hungry, even though you're eating. And that can be because the glucose is in your bloodstream. It's not entering your cells, so it's not being utilized for energy by your body. It's just kind of hanging out there in your bloodstream. You could, as a result of not having that access to the energy source, you could feel extremely fatigued. You could end up with blurry vision, cuts, bruises that are slow to heal because the blood isn't able to reach those different cells to bring the immune factors that are needed for healing. Because again, the glucose in your blood is making it really thick, and it's hard then for it to travel around your body and do its normal processes. In type 1, people may experience some weight loss even though they're eating more, and that is because they're not able to absorb and utilize that, or they're able to utilize that, the glucose. And you may feel this is sort of a late stage sign, but the tingling, pain, or numbness in the hands or feet, and that has to do with the nerve damage and inability of the blood and the glucose to travel to those cells on the extremities. So I mentioned blood glucose a lot, and really we're talking about the sugar, the glucose that's traveling through our bloodstream. And once you have diabetes, you're going to want to monitor and manage that number. And so these are some goals of what you want it to be. It needs to be in sort of a healthy range in order to support normal functioning. Too high is dangerous, too low is dangerous. And so for somebody without diabetes, so somebody who hasn't had that diagnosis, who has healthy glucose metabolism, before a meal, they're going to want their blood glucose to be less than 110 milligrams per deciliter. And then 2 hours after starting a meal, they're going to want it to be back down to 140. Under 140. It's going to rise when the food is eaten, and then because insulin is working correctly, it's going to go down. With diabetes, assuming you are on a management plan that your doctor prescribes where you're testing your blood sugar before and after a meal, and you may not be for every single meal, but if you are, ideally you want to see a number between 80 and 130 before and less than 180 2 hours after. So that's a sign that you're managing your blood sugar with either your medications, your exercise, your food choices, or some combination. All right. So what is going to make your blood sugar high? Okay. So I talked about how eating carbs is what results in your blood glucose or blood sugar going up, so rising. If you eat more carbs than normal at a given meal or snack, your blood glucose is going to be higher. And that would actually be true for somebody even without diabetes. But in somebody without diabetes, the pancreas will then respond appropriately with making more insulin. Being physically inactive, that can also make it high. And we'll kind of get into why that would happen. But basically, exercise is one of the factors that helps lower it. So being too sedentary for too great periods of time during the day can definitely cause it to go up. Not taking enough diabetes medications or insulin if you're prescribed. Side effects of other medications, that actually can happen. Steroid drugs, for example, definitely can spike glucose levels, and if they're taken for a long period of time, in some cases for managing another disease, can actually lead to prediabetes or diabetes. Infection or other illness, absolutely. If you're sick, if you're in the hospital with some sort of serious infection or disease, your glucose levels are going to be higher. Hormone changes, so menstruation for women, and stress. So important to manage stress, build in relaxation, deep breathing, lots of reasons to do that, but certainly to manage blood sugar. And then what would make it low? So eating less carbs than normal can certainly result in lower than expected blood sugar levels. Getting exercise, so when we're exercising, our blood sugar is going to go down. Missing a meal or snack, again, since eating, especially carbs, is going to raise the blood sugar. Not eating would cause it to be low. Alcohol, especially on an empty stomach, yes, definitely. The liver is working to process the alcohol, so it's not able to do normal metabolism of the carbohydrate. Taking too much of your diabetes medication, overdoing it with the insulin, especially if you're also making changes to your lifestyle. So making changes to your eating habits, your exercise habits, and you haven't adjusted your medications accordingly, or your doctor hasn't, you could end up with too low blood sugar. And same thing, side effects of other meds, there's always going to be potential interactions. All right, so we've mentioned A1C. Managing your diabetes really does mean staying on top of that number, again, because it's a really good way to gauge what's been happening with your blood glucose control over 3 months. But it's more really successfully staying on top of diabetes and preventing long-term complications and promoting overall health. It's not just looking at your blood sugar, it's also staying on top of your blood pressure and your cholesterol. So that's why we say ABCs, and it's catchy. Oftentimes, heart disease risk factors and diabetes risk factors go together. So it is pretty common for someone with prediabetes or diabetes to also have blood pressure, high blood pressure, or high cholesterol, or be at higher risk for having those conditions. So A1C, got into this a little bit, it's a measure of your blood glucose control over the past 3 months based on how much sugar is hanging out on your red blood cells. The American Diabetes Association recommends people with diabetes have a A1C goal of about 7%. However, you and your doctor will work to determine what your individual goal will be, and it will depend on your personal history and what your levels have been. Again, a normal A1C, healthy, no diabetes, less than 5.7%, prediabetes, 5.7 to 6.4%, diabetes, greater than 6.5%. And this isn't something you can test on your own, like a fasting glucose. This is something you're going to have done by a physician or in a lab setting. And this slide is pretty cool. It's showing you, so the A1C is measuring your average blood glucose control, and it's showing you what that actually looks like if you were to finger prick and see what your blood glucose was like on any given point. So say you go to your doctor, you get your A1C measured, and it's come back at 7%. That means that on average, your blood glucose was hanging out around 154 milligrams per deciliter, which if you look back to the goals pre and post meals, it's a bit higher than that range. So that's why we want it to be, our A1C to be less than that. So that means that our average blood glucose is more in a healthy range on a more consistent basis. So blood pressure. What exactly is it? For any of you who are not familiar, but you've probably heard this term before, it's actually a measurement of the force of your blood inside your blood vessels as it's traveling through your body. So the top number, it's called the systolic. It's when your heart is pumping. So that's going to be the higher number, and that's the pressure when it's pumping. And then when the heart is relaxing, that's the bottom number, diastolic. It's when your heart's at rest. And this is important. So when your blood pressure is high, your heart has to work harder. And your heart working harder is going to put you at risk down the line for some heart disease issues, right? So we want to make sure we're keeping our blood pressure in the healthy range so that we're protecting our heart and we're not increasing our risk for cardiovascular disease and stroke. And healthy blood pressure is defined as less than 120 over less than 80. If it's higher than 140 over 90, your doctor may prescribe a blood pressure medication like an ACE inhibitor or a diuretic. But less than that, typically lifestyle factors are recommended to help lower it. Cholesterol. So cholesterol is a waxy fat-like substance, and it helps to make hormones and form vitamin D. So it's not bad. It's actually necessary. It travels through the blood in something called a lipoprotein. It's a combination of fat and protein, and there's 2 types. So you've probably seen these on your lab reports. If you're in this program, you've actually had to get this panel done. High-density lipoproteins, or HDL, we consider that good cholesterol. That actually helps our body clear cholesterol or the fat out of our bodies to be processed by the liver. So having high levels of HDL is actually cardioprotective. We want that to be greater than 50. in women and greater than 40 in men. The LDL, the low-density lipoprotein, that's the bad one. So that number we want to be lower because having too high of that number, it can clog up our arteries and increase our risk for heart attack and stroke. So that's the number we really want to keep on the lower end. And the way I remember this is HDL, so H is for healthy, LDL, L is for lousy. So if that helps you, keep that in mind. Triglycerides are another type of fat in your blood, and it's a storage for energy for your body to use in between meals. It tends to be high when blood sugar is high. Some of the risk factors are really similar of what's going to spike it, like sugary beverages and a lot of concentrated carbs. It also travels through the blood in lipoproteins. I sort of went through this already, but the HDL is heart protective and is carrying the cholesterol to the liver to be eliminated. The LDL, on the other hand, the lousy one, can build up and clog your arteries, increasing risk for heart disease. And the triglycerides, the fat in your blood, can also contribute to hardening or thickening of the artery walls, and again, increasing your risk for cardiovascular disease. If you have high blood glucose, you're very possibly also going to have high cholesterol, high triglycerides. And one of the reasons is if your blood glucose is high, it's not entering your cells to be able to be used for energy. Your body needs an alternative energy source. So it's going to rely on, it's going to pull these triglycerides and cholesterol out as an energy source. In order to manage these levels, a lot of the same lifestyle factors and recommendations that we're going to talk about for managing diabetes are going to also help with the cholesterol. But keeping your blood glucose levels in check, possibly adding a medication like a statin, if your doctor prescribes it, may help. And there's a genetic component too, I should mention, for both hypertension, which is high blood pressure, and cholesterol. Just like with diabetes, you know, there's lifestyle factors, there's things you can do to manage it, but there's also that genetic risk. All right. Another risk factor for diabetes and high blood pressure and high cholesterol is your weight. Being overweight or obese is associated with an increased risk for all three. So the A1C being high, the blood pressure being high, and the cholesterol being high. So if you are overweight or obese, losing weight can help with that long-term management. And it doesn't have to be drastic. What the research really shows is even just 8% loss of your body weight can lead to a major, major improvement in those levels. So the A1C, the blood pressure, and cholesterol. But the key is losing weight in a healthy way and keeping it off. Yo-yo dieting, losing weight, and regaining it actually increases health risk. So what we really want to do is focus on sustainable changes to our nutrition and our physical activity so that the weight loss is also sustained, and so are the health benefits and the disease reduction. Medications. So a bit outside my scope as a dietitian, I love to focus on the lifestyle factors. And if you are really consistent with them, it's very possible to get off medications. It's not something you should do on your own. You do want to take your medications as prescribed. So they're a really important part of managing your diabetes, and it's something that your physicians are going to work with you. And everybody's going to be different what medications they're prescribed, but you got to stay on top of them if you want to control your diabetes. So some of the medications you might be on would be insulin, definitely if you're type 1, possibly if you're type 2. Some medications to control blood sugar, which we call anti-hyperglycemics. Metformin is a common one, but there's a whole host of others. Medication to control blood pressure, like ACE inhibitors or diuretics, and then statins are pretty common for managing high cholesterol. All right, so now we're going to get into the lifestyle factors that you can start practicing to better manage your diabetes, keep it under control, prevent it from progressing. We're going to talk about physical activity, and we're going to talk about nutrition. Specifically carbs. We're going to get into carb counting a bit more in the next presentation, but we're going to go through and make sure we're all on the same page about food sources of carbs, what they actually do, and how to choose the best ones for our bodies. Physical activity. So there are so many benefits. I can't even stress enough how important getting regular physical activity is. I mean, it's going to strengthen your heart, your muscles, and your bones. It's going to help lower that cholesterol. It's going to help lower blood pressure. It's going to help lower A1C and blood sugar by acting as a natural insulin. There are mental health benefits. There are cognitive benefits. It lowers risk of cancer. I mean, it's associated with pretty much everything you could want for yourself when it comes to health and mental health. So move your body. That's the biggest thing I can kind of recommend. The American Diabetes Association recommends, and this is the same as the American College of Sports Medicine and the general physical activity guidelines from the government, greater than or equal to 150 minutes per week of moderate intensity aerobic exercise. So that's your walking, jogging, cycling, dancing, anything that gets your heart rate up. Moderate means you can carry on a conversation. So it's not vigorous, it's not all out. But this is super important, and it's great for your heart health as well as lowering that blood sugar. You want to do it at least 3 days a week, and you don't want to go more than 2 days without exercise because you kind of lose the carryover benefit. So what I'd recommend is starting to do 30 minutes on at least 5 days a week. And this is a minimum, and this really is a minimum. The more the better. The other recommendation that is less commonly kind of promoted, but it is actually really important, is doing resistance training, some form of strength training. That means moving your muscles against any kind of resistance. It can be body weight, it can be weights, it could be machines. You want to do at least 2 days a week of that, non-consecutive days. But that's the only real way to preserve lean muscle mass as we get older. And that's going to maintain metabolism, and the muscles are a repository for blood glucose, so the more we have, the better able we are to clear glucose from our blood. We also want to reduce sedentary time. As much as we're focused on increasing physical activity, cutting down on that time that we're sitting is also really important. So, between desk jobs and long commutes and so much technology now, we're sitting a lot, and it's not good for us. So every 90 minutes, you want to make sure you get up and move. Maybe set a timer on your phone, or get some sort of wearable device that's going to remind you when you've been sitting for too long. Do your holiday shopping on foot instead of ordering online. Do your grocery shopping on foot instead of ordering online. There's so many convenience things now that are actually, unfortunately, kind of working against our health. So how does exercise actually impact blood glucose? It's super cool. It's kind of like magical. There's two main ways that it works. Immediately, so acutely, as you're doing exercise, there are metabolic changes that occur that allow glucose to enter your cells without insulin. So exercise acts as a natural insulin. Then over time, it can improve the insulin sensitivity of those same cells. So even when you're not exercising, it helps manage your blood sugar, and over time can directly then lower your A1C. Remember, that's your measurement of how well you're controlling your blood sugar. Since exercise helps to lower blood sugar, it can lead to hypoglycemia, so your blood sugar being too low, less than 70 milligrams per deciliter. And I mentioned that some of the common symptoms of diabetes or hyperglycemia, high blood glucose, can mimic low blood sugar. So some things like feeling fatigued, feeling dizzy, feeling lightheaded. If that happens and you have access to measuring your blood glucose, you'll probably see that it's super low. So it's very, very important to eat carbohydrates before exercise, and if you're insulin dependent, if you do need to dose insulin, to take your exercise into account when figuring out your needs, and that's something to work with your nurse, educator, or your physician. You may want to consider getting some sort of a medical ID that has your emergency contact information that you can wear on you when you're exercising in case something does happen. People know how to help you best. So here are some of the signs, kind of covered some of them, but shakiness, sweating, chills, clamminess, not a fun feeling, being confused or irritable, sort of like that hangry feeling that we may get, rapid heartbeat, feeling nauseous, blurred or vision impairment, headache, tingling, numbness in your lips or tongue. So none of this sounds fun. It actually could be kind of scary if you find yourself on a treadmill or a piece of exercise equipment and suddenly these changes are happening. So what you want to do is make sure you always have simple carbs with you when you're exercising. So you don't need a ton, 15 to 30 grams. Some people with diabetes want to keep glucose tabs. It's something you could find in like a CVS or a Walgreens in the diabetes care section. But anything with sugar is gonna have the same effect. So you could use those sports gels that long distance runners use. You could have some dried fruit like raisins. You could have a little bit of juice or regular soda, or some kind of hard candy, jelly beans, or gumdrops. So kind of, since we're addressing low blood sugar here, all these foods are all designed to immediately increase your blood sugar. Foods that, in general, for diabetes management, we actually want to limit, which we'll get into shortly, because they are going to spike your blood sugar and cause it to go up immediately. And that's what we want to avoid for managing long term. But in the case of hypoglycemia, we need it. Okay? So we're going to have a small dose of something with some simple carbs, which is sugar. You're going to check your blood glucose again in about 15 minutes. If it's still low, if it's still less than that 70 milligrams per deciliter, repeat with more carbs. And then once your levels are normal, you want to have a healthy, balanced snack. And a good guideline for any healthy, balanced snack would be to include something with fiber, fat, and protein. So all three of your macronutrients. All right, so exercise, we covered that. We started getting a little bit into how food, specifically carbs, affect blood sugar. Nutrition really is, it's super important. How you fuel your body, what foods you choose to eat, how often you eat throughout the day, how you balance your meals. That's arguably the biggest tool you have to manage your diabetes long term. And basic nutrition, you may have heard the term macros or macronutrients. All foods that provide calories provide them in the form of one of these three macronutrients. So fat, protein, and carbohydrates. For diabetes, we really do focus on those carbs because they are the macronutrient that are going to directly impact our blood glucose. If you remember that first slide, we talked about we eat carbs, our blood glucose rises. That's how the body responds. So we eat carbs that it gets absorbed, and then it gets broken down and is absorbed into our body as sugar, as glucose. So how we eat carbs, what carbs we eat, plays a big role in managing our blood sugar levels. So what do carbs actually do for us? They've gotten such a bad rep recently, maybe not recently, probably in the last 20 years, but they're actually really important as a quick, easy energy source. So they are immediately available for our cells to use as energy, which is why it's so important to fuel for exercise with carbohydrates. They're also our brain's preferred source of fuel. So anyone on a low-carb diet, or you're trying to cut carbs, maybe you just have a salad for lunch, you may find your brain feeling a little foggy. And this is even if you don't have diabetes, because carbs really are our brain's preferred fuel source. We function best, we think best, we exercise best with carbohydrates in our diet. But not all carbs are created equal, and some are definitely more nutrient-dense than others. So we're going to get into that, but we're going to go through the three different types of carbs because there's so much misconception around this. There's starch, there's sugar, and there's fiber. A lot of foods are going to have a combination of all three, even something like a vegetable or a fruit. So we do want to focus on fiber-rich carbs to manage diabetes and really promote overall health. So our food sources of fiber are going to be our whole grains, our fruits and veggies, our beans, legumes, and lentils, and plain dairy. So sweetened dairy, so vanilla, blueberry, strawberry is going to have some added sugar. Plain dairy is just going to have a little bit of naturally occurring lactose sugar. So let's take a closer look at each of these components here. So starch is it's the main sort of part of the grain that when we're eating something like white flour, we're really getting we're getting a lot of starch, right? So you may have heard the term starchy vegetables. Those are foods like potatoes and corn and peas that have more starch than a food like broccoli or string beans or asparagus. But we're talking about a grain, a whole grain. This is why we encourage whole grains. There's going to be three main parts there, okay? So there's going to be the endosperm, and that's the starchy goodness that's going to be used to make the white flour. But then a whole grain is also going to have the bran and the germ. So the bran is where the fiber is. It also contains some important B vitamins and other minerals too, like iron and folate. Well, that's actually a vitamin. The germ is that's where the healthy fats are, so some essential fatty acids, like omega-3s even, and vitamin E, which is a fat-soluble vitamin. And then we have that third component, the endosperm, which is the pure starch. So there is also some protein in whole grains, and some of it's in the bran, some of it's in the germ. But when we strip the bran away and we strip the germ away, we're losing that fiber, we're losing that fat, we're losing some nutrients. We're just left with that starchy endosperm. And as a result, it gets digested and absorbed super fast. It's going to raise blood glucose levels super fast too. So eating white flour compared to whole wheat flour, eating white rice compared to brown rice, plain pasta compared to whole wheat pasta, you're going to see a much more rapid rise in blood glucose levels with just foods that are just the starchy endosperm. So when we're thinking about controlling our blood sugar, that's why we always want to go with whole grains when we can. Sugar, another component of a carbohydrate. Actually, besides fiber, all carbohydrates are going to break down to sugar or glucose in our blood. But how fast that happens definitely depends on whether we're choosing a food with how much fiber is in the food that we're choosing. And there is a difference when it comes to nutrition between a naturally occurring sugar or a food that naturally has sugar versus a food with a ton of added sugar. So, for example, dairy, like I mentioned, all naturally contains lactose, which is a simple sugar. And fruit, like an apple or an orange or a pear or a peach, naturally contains fructose, which is a simple sugar. Even though sugar, you're getting a lot of other nutrients when you're eating or drinking dairy or fruit. You're getting that fiber, so it's not going to have that really rapid effect on your blood sugar. And you're also getting a ton of vitamins and minerals and antioxidants. So we don't want to fear naturally occurring sugar in dairy and fruit. Added sugar, however, it can add up, and it's also going to tend to be found in our less nutrient dense foods as opposed to our dairy and our fruit, which is very nutrient dense. The way we would know that there's added sugar in a food product is really to look at the ingredients list. The new food label is starting to identify naturally occurring versus added sugars. We're going to get into how to read a food label in the next part of the series. So you may start to see it on some food labels already, companies that are voluntarily putting that on there. So you'll see total sugars, then you'll see it broken down into added. But if you're looking at that ingredients list, there's a lot of names for sugar. And so these are some of them here. I'm not going to read them all, but really anything that ends in oath is a sugar. And then there's a lot of other, foods that really, they are just sugar, honey, agave, maple syrup, coconut sugar, raw sugar. It's exactly the same in your body. So that's very, very common misconception, is thinking that you're doing yourself a favor from a nutrition standpoint by using agave or maple syrup or coconut sugar or raw sugar. And if your preference is to use that, by all means, go for it, but it's going to have the same impact on your blood sugar. So the real guideline is to manage how much you use. So fiber is the third type of carbohydrate. And again, most foods that have carbs are going to contain all three parts. So they're going to have starch, they're going to have sugar, and they're going to have fiber. We love fiber. We love fiber because it is digested more slowly, and that as a result, blood glucose rises more slowly. So it's really, including fiber in your diet is a really important way to keep blood sugar under control. It also keeps you full longer, so it can help you eat less overall without feeling too hungry, which will in turn assist with weight management. And it can help lower blood cholesterol, specifically that LDL, which again is the lousy, the less good one for our hearts. It is naturally found only in plants. Fiber, there's two types, soluble and insoluble. Most foods are going to have a combination of the two. Something like oats is going to have more of the soluble fiber. Something like bran is going to have more insoluble fiber. But most fruits and vegetables are going to have a combination, whole grains, beans, legumes. Again, it's going to slow that release of blood glucose into the bloodstream, and it's also going to help lower that cholesterol. Plus, if you're focusing on eating more foods that naturally contain fiber, that means you're eating more plant-based foods, and that's going to have a direct positive impact on all sorts of health outcomes. There's definitely fiber supplements too. In general, I don't think you benefit the same way when you try to isolate a compound of a food into a supplement form. Some people may be on some sort of fiber supplement if they have issues with constipation, but your best bet is to focus on getting fiber from food sources. we recommend 25 to 30 grams a day. Really, that's a minimum level. You don't want to eat too much either, especially without increasing your fluid intake or if you're brand new to fiber, because that's going to actually constipate you. So start slow if you're kind of new to it. Gradually introduce those whole grains and those veggies and increase your fluid intake for sure. So making your carbs count, we're going to get into actually counting carbs in the next part of the series. But really what this means is focusing on those food sources of carbohydrates that are going to give you the most nutritional bang for your buck. And this is such an important kind of concept to keep in mind for overall nutrition and health. Not that there's not a place for treats and sweets and your favorites in moderation, but for the most part, you want to focus on making your food choices really nutrient dense. So it's less about avoiding carbs. It's more about choosing the right ones. And a way to kind of exemplify that is thinking about a whole fruit versus juice, because sugary beverages, and that includes juice, is one of the worst offenders as far as its impact on blood glucose and managing diabetes. And that's because you think about there's naturally occurring sugar in fruit, right? And you think about how many pieces of fruit it goes into making a glass of juice. So as you can see in this picture here, it's 5 to 6 medium oranges to make a glass of juice. You would probably never eat 5 to 6 medium oranges. You'd probably eat one. And you'd get 15 grams of carbs, and you'd be eating the fiber, and it would have a minimal impact on your blood sugar, and you'd be getting tons of vitamin C and other antioxidants. You drink a glass of orange juice, on the other hand, you're getting 5 to 6 times that amount of sugar, and you're not getting any of the fiber. So you're going to have that blood sugar spike, and you're not going to feel full the same way you would. So swapping out juice for whole fruit is just one really simple swap that illustrates that idea of making those carbs count. If you do want to have juice on occasion, I would probably recommend doing just a splash of it, and doing the rest seltzer or water, or cutting it at least in half, seltzer and water. But avoiding sugar-sweetened beverages is probably a first step I'd take if you're looking to make some changes to your habits, and that's something that you do have regularly. So that's your juice, that's your sweet tea, sweetened cola beverages, not diet. Diet doesn't have any sugar. Sports drinks, those fancy coffee drinks, those would be the first things that I would say get a handle on your intake, and you're going to see a direct benefit on your blood sugar. When you do eat carbs, what you eat them with is also super important. So it's not just which types you choose, but what you're eating them, what else you're pairing it with. So if you eat a carb with a source of fat or a source of protein, those two nutrients are going to slow down the absorption of the sugar that's in the carbohydrate, and you're going to get more steady blood sugar control and more steady energy levels. So for example, if you were going to have a piece of fruit for a snack, if you pair it with a string cheese or a tablespoon of peanut butter or a hard-boiled egg, you're going to have a much more stable blood sugar control and feel satisfied for longer than if you just had that fruit. And most times a mixed meal is going to have a combination of nutrients like that, but we do want to avoid meals that are just carbs. Breakfast is certainly a time where a lot of our favorite foods are carb-rich. So you think cereal, you think toast, you think jam, juice, fruit, oatmeal, pastries, muffins. It's all carbs, right? So what we really want to do is pick one and then pair it with some eggs, some Greek yogurt, some kind of protein source to balance it out, and a little bit of heart healthy fat too. So some nuts, some nut butter, maybe an avocado. And another part of making your carbs count, like I mentioned earlier, is choosing those whole grains instead of the refined, because you're going to get more fiber. And you're also going to get more nutrients. So remember, the bran and the germ have some things that is not in the starchy endosperm. So choosing whole wheat bread, wraps, flatbreads, pasta, brown rice, any kind of whole grain that you like, farro, barley, quinoa, oats, and experiment. If you're brand new to it, do half and half until you kind of get used to it. You can do that with cereal too, like half whole grain cereal, half, your favorite corn pops, and slowly change the proportions so you're getting more and more of the whole grain. All right, so we're wrapping up today. We will hopefully have some time for questions if you have any. We want to know our numbers, right? So that's our A1C numbers, our blood pressure, and our cholesterol. So check in regularly with your doctor. That's where you're going to get those levels measured, and make sure that with your lifestyle changes, you are keeping those numbers in the healthy range. If your doctor prescribes you to monitor your blood glucose on a daily basis, do it. That's the only way you're going to know on a day-to-day basis how well you're doing and how your food choices are impacting your blood sugar. Taking your meds as they're prescribed. Again, if you are consistent with these lifestyle changes, you're getting your regular exercise, you're eating consistent carbs, you're managing your weight, you may not need medications forever. But while you need them, you need them. And it would be dangerous to try to go off of them on your own. And so when it comes to carbs, what we're going to talk about actually a little bit more next time. So I kind of just did a brief overview of how carbs impact blood sugar today. We're going to get into the plate method and carb counting actually in the next presentation. And exercise. Move more, right? Less sedentary time, more movement. I mentioned different types of, physical activity, our aerobic exercise, as well as our resistance training. But actually just be more active in our day-to-day lives can also really be helpful. So, you hear park farther away, take the stairs, things like that. Choosing the on-foot option instead of the convenience option. If you're interested in kind of tracking how active you are on a day-to-day basis, getting a step tracker, right? So getting a Fitbit, getting some sort of wearable that you can kind of look at where you're at on a given day and then set some goals to increase your activity, because it's certainly going to benefit that A1C, the blood pressure, the cholesterol, your weight, your mood, all those factors. So love some exercise. All right. So next time, we're going to, hopefully you'll join us again and scare you off. We're going to address some hot topics in diabetes care, so some fads you may have heard of, some myths you may have heard of. We are going to take a closer look at how to read that food label and how to use it to make food choices that support your best blood sugar control, and learn some practical tools for living well and eating well with diabetes. So that includes the plate method, it includes carb counting, and it includes how to utilize the glycemic index. Thank you for tuning in today. I really do hope that this was empowering and helpful and not scary, because absolutely it is up to you and it is doable to manage that blood sugar and manage your diabetes long term, prevent those consequences. If you are interested in learning more about the Good Health Gateway program, the website is here and the number is also here. And if you have questions for me, you can email me at apalladino@goodmeasuremeals.com. I see clients for individual nutrition counseling here. I do work with people with diabetes. I don't know what you all have access to through that program, but if you want more support, you definitely can reach out to me.
So, Alyssa, this is Sarah, and thank you, Alyssa, for walking us through the presentation. We did have a couple of questions come in, and we do have a few minutes, so I think we'll take the few minutes to address some of what came in. We had a couple of people ask about being able to see the presentation after the fact, so after today, and so the answer, of course, is yes. You will be able to view it afterwards. Not only will we be sending it to all of our employer groups, we'll also be providing a link for everyone to view the presentation on YouTube as well. So more to come on that. In addition, we had a couple of questions that were very specific to diabetes medications. And
okay.
So for answers to those questions, we're just going to refer back to our nurse educators that we have on staff here, and we'll get back to those folks individually on those. But we did have a couple of questions for you, Alyssa, so we want to just dive right in. We had a couple of questions actually about alcohol use for people with diabetes, so just hoping you could just reiterate kind of what you reviewed earlier about, the impacts of alcohol on someone with a diagnosis of diabetes.
Yeah, so it's definitely something to be more mindful of if you have diabetes versus not. In general, for overall health, we recommend alcohol in moderation, which is considered 2 drinks per day for men and 1 drink to half a drink a day for women. And you cannot save those up and have them on the weekends. It really is like a daily maximum. And 1 serving is defined as 1.5 ounces of a hard liquor, 12 ounces of a regular beer, or 5 ounces of wine. And if you have diabetes, you have to see if you have access to test your blood sugar, you're going to probably notice that it can lead to hypoglycemia more so than somebody without diabetes. So that's more the risk than hyperglycemia, actually. But it's not fun. It's just some of the same symptoms that you would experience exercising. But yeah, it's something to be mindful of more so than you would be otherwise.
Great, thanks. We also had someone that is asking about managing their diabetes over the holidays, which, of course, as you know, this time of year is totally relevant with Thanksgiving and
yes,
the holiday season coming up in December. So what's your best advice for keeping diabetes in check over the holiday season?
Oh, man, that's a good question. And honestly, it's kind of the same recommendations I would give to anybody who's concerned about, like, sticking to healthy habits during the holidays and not gaining weight over the holidays. So make sure you do some form of physical activity as consistently as possible. That's going to offset some of the excess calories and sugar that you might be taking in during a big holiday meal. But it also can help manage stress and improve your mood, which, you know, during the holidays, it's not all smooth sailing for everyone, depending on how well you get along with your family or not. So definitely fit in some more physical activity, especially on those days where you are eating a big meal. Do not save up all your calories for the big meal. So that's important for anyone, because if you go into a big meal ravenous, you're much more likely to overeat. But especially important for keeping blood sugar under control is to eat frequently throughout the day, every 3 to 4 hours. So still have a balanced breakfast. If your holiday meal is dinner, have a lunch. And then a couple hours before the big meal, have a balanced snack that has some kind of fiber and either protein or healthy fat. So have a handful of nuts, have a piece of fruit with some peanut butter. You want to go in with pretty stable energy levels and blood sugar levels and not go in ravenous. And then the final tip, this is going to come a little bit late, but it'll help you with Christmas, not so much for Thanksgiving, is to use the plate method when you're building out your plate at a holiday meal. We're going to get into detail in that in the next part of the series, but focus on your veggies. Fill at least half your plate with lots and lots of veggies, which are high in fiber and water and low in carbs. Include a lean protein source in 1/4 of your plate, and in the last quarter of your plate is where you're going to fit in all your starchy favorites. Stay hydrated. Thirst often masquerades as hunger, so drink your unsweet tea, drink water, drink seltzer when you're at your holiday parties, and be careful with the alcohol for sure.
Perfect. Thank you. All right, so I think we're just about coming up on the hour here, so we are going to wrap things up. And as Alyssa mentioned, we will be having part 2 of this series on November 29th at 12 p.m. Eastern Standard Time. And reminder invites will be going out in the next week or so for everyone to register that hasn't already done so. But just, would love to thank everyone for joining us today, and have a good rest of your afternoon. Thanks, everyone.